Hello, I'm Dr. Calvin. Welcome to CaneRx. In this video, I want to break down and I want to explain my favorite approach when using the CaneRx in practice and how I prescribe it for home therapy. Practitioners have literally been using forms of compression over millennia to help treat and soothe the aches of daily life. Techniques over the years have enabled millions of people improve quality of life, from professional athletics to recreational play, to return to work, or just being able to lift those grandkids again. Compression and manual techniques have either single handedly or in conjunction with other therapies provided, established itself as really a crucial role in obtaining and maintaining a healthy body. Compression to distension technique, or C2D, is your route into the world of compression techniques that's best suited to enable you, the home user, to perform these therapies conveniently, effectively, and on an as needed basis. Before we start down that road of the techniques, I want to first explain the acclimation accommodation cycle to you. This is something you're very familiar with, but maybe haven't been reminded of it in a long time. Acclimation accommodation is how our body's response to stress and how it improves, how it kind of gets bigger, badder, stronger, faster. For example, when you go to the gym and you go to work out, you're not building muscle in that moment. You are breaking down. You're not building muscle, you're breaking down. As a result of all that breaking, your body puts in scar tissue, contracture, inflammation, lactic, all these things sort of rush to those different breaks to sort of start to engage the healing process. In that process, there's scarring there. Your body comes and starts to break down that scar. Kind of like if you cut your skin, you're going to get a scab. That's a scar, form of scar. And your body over time breaks that scar tissue down. It has the processes to do that and reabsorbs it. And as it's reabsorbing it, it starts to put down new stuff. Then, in a period of 6 to 8 weeks, you're bigger, better, stronger, faster. And that cycle's ready to go again. And all that exists below what we call the physiological threshold. So, your body's ability to self regulate that injury. So, you break down, you scar, your body breaks down the scar, and you put down new stuff. And that cycle just keeps going for you for the most part, uninterrupted. You don't have to do a lot about it except drink water, eat food, get sleep. Once in a while, that scar tissue, the amount of injury either accrued over a long period of time, like forms of micro trauma, like bad posture, for example, is a good example, or something a little bit more exaggerated, like a car accident, a fall down a flight of stairs, skiing accident, etc., or a combination thereof, will put your body over that threshold. Will throw that injury over that threshold. And that's represented by one, that scar tissue acts like rust in a door hinge or rust in a bicycle chain link. It doesn't allow it to move the way that it should. And so you're limited in range of motion, number one. Number two, there's typically an increased, exaggerated inflammatory response with that because the body needs to move that area to nourish it. So if it can't, it's going to have trouble nourishing it. That's going to signal an exaggerated inflammatory response. So maybe it's already inflamed because it's trying to heal. And then that throwing that over that threshold and it can't move enough to nourish itself, that's going to exaggerate an inflammatory response. So now you've got pain with it as well. And that's usually when they come in. That's usually when I get them and they hire me because I'm set up to do just that. Like many other chiropractors and manual therapists out there, we use a variety of different modalities to help seek, find, and break down that scar tissue technique, and compression to distension is one of them. As we get in there and break that stuff up, I tell patients it's like you bringing in a bag of ice cubes all frozen together. You want me to help you melt it. I don't melt a single cube, but I'm going to take that bag of ice cubes and I'm going to bust it on the ground, break it up into a million pieces. Now, we both know as we do that, that increased surface area of those ice cubes to the air and to the sunlight is going to help it melt faster. And that's exactly what we're doing with these compression and adjusting techniques in the clinic. You're going to learn the compression to distension, which is the technique that I've found over the years to be the most direct, the most uniform technique to achieving that real goal of breakdown. And how that works is essentially we're going to use compression. In the form of compression is going to be kind of anything you can get your hands on. You could use your fist, you could use a thumb, you could use one of those hard rubber balls, the lacrosse balls, you could use one of those hook devices, you could use a roller stick, regardless, a friend's elbow, regardless, you're going to find something to create compression for you. Now, the critical part of the compression to distension technique is A, the threshold at which we push, and B, the length of time in which we push. Let me explain. The first part, the threshold, I use what's called your pressure threshold, which is not your pain threshold. Your pressure threshold is the max amount of pressure you can tolerate, but remain completely and totally relaxed. See, there's a threshold when you're down, when you're putting somebody's putting pressure on you that you could tolerate and not really elicit a contraction. And then it gets to a point where it's not necessarily your pain threshold, but you're going to have to start tightening up. That's your pressure threshold right before you would tighten up. Now, anybody trying this technique, at first, you're going to absolutely stink at it. That's okay. Do it. Try it and do it. You're going to find yourself stopping and restarting several times. I'm going to go over those rules in a minute. You will eventually grasp the concept. When people come in the clinic the first time, I'd say a good 80 to 90% of them get it the first session. Some of them take several sessions to sort of kind of really contemplate and understand like what we're trying to achieve here, what that pressure threshold is, because we're so used to going to pain threshold. If a little's good, more must be even better. That's not what I want to do. I want to go to that pressure threshold. So we're pushing in max amount of pressure you can tolerate and stay totally relaxed. And then we're holding it. The hold is pushing those ice cubes apart, right? So that principle, that fluid dynamics of the tissue, it is trying to get out of the way. But depending on how rigorous the underlying tissue is, whether it be through scarring or contracture or inflammation or whatever is bundling up that tissue and making it contracted and short, is varying degrees of release times. So some are going to release in healthy tissue about 5 seconds. I've held a spot for 2 minutes on a patient before it finally gives way and gets out of my way. And that is the secret right there. That's the secret sauce. That's the pure objective, is creating that lengthening of that tissue. That lengthening of tissue will be represented by you feeling like that got a little easier. So to give it numbers, when you get to that pressure threshold, I just tell patients call that a 5 out of 10 on a pain scale. That's a 5 out of 10. I'm going to hold it till that feels like it drops a notch to a 4 out of 10. So it's very subtle, but it will be obvious that it gets a notch easier. And at that point, we can move. So that objective of that distension is everything. If we don't get that distension, we didn't do what we set out to do. There may be some other benefits to it, but we have to get that tissue to distend. We have to get it longer than where we started. We have to break those ice cubes up and make them easier to absorb and melt, the scar tissue, of course, by our bodies, and so that it can get right back into that remodeling phase. You're just hung up in this excess of scar tissue. We start breaking that down. It's kind of gross, but like picking a scab, we start breaking that down and the body starts moving back into that cycle again. And the whole point is to get you, not to stop the process, but to get you to self-regulate again. Now, a couple of rules. Number one, where that tissue becomes dysfunctional, think of it as like a piece of leather patch being sewed into a pair of spandex. Okay, your body in normal circumstances is this nice uniform piece of spandex. Just think of it that way. And then where these injuries accrue and build, and these scar tissue pockets build, is like a leather patch put in there, sewn in there. When you go to stretch that spandex, now you feel the resistance because that leather obviously isn't as stretchy as that original spandex, but you don't feel it in the patch and you don't feel it in the spandex. Where you feel it is that seam of where that leather meets the spandex. That seam is where all the stretch and stress is. And that's where you typically, now I'm saying typical pain patterns, I'm not talking about some of the other atypical and but typically where you feel the pain, it hurts right here, it hurts right there, it hurts right there. Those particular spots where it's like that's where it hurts, that's where we're going to find the lion's share of this congestion or contracture, shortened scar tissue type of tissue. Okay. And so X marks the spot. That's what makes it nice and makes more convenient. And that's what actually going to make you better at this than the practitioners because you know exactly where that needs to go. And so you're going to take whatever device you're going to use. And I'm going to introduce you to the Cane RX because it's your multi-tool for this particular type of therapy. But whatever you have access to, whether it be like I said, a friend's elbow, a lacrosse ball, or even your fist, you're going to go to that site and you're going to start compressing. And you're going to work to that threshold and you're going to hold it until you get the fade and then we move it. Now, movement is in increments of like a quarter to a half an inch. We're literally just moving it in these little tiny increments because we have to create uniformity in that tissue. Where you break it up here is not going to translate to here. And so we have to break it up there and then there and there and there and so on and so forth. And so that may stretch an area of 5, 6 inches, maybe even longer, depending on the extent of the tissue. And it's typically linear. And so you'll find these patterns where you're going down these lines this way or going down if you're on my back and you're going down, up and down the lines of the spine. But you're just going to go pick a line and you're just going to walk through that tissue incrementally, step by step, a quarter inch or half inch, going to that threshold, holding it, sustaining that pressure until you feel like it gets a little easier, then we're moving it. So it's the pressure threshold, wait for the fade, and then move it again. Now, a couple more rules. When you're using this therapy, and say you get to that compression, what you think is that pressure threshold. Number one, if you get to that quote unquote 5 out of 10 and you stop there and then it continues to increase, so it starts to go to a 6 or a 7, get off it, stop, and restart. One of the beauties of using that pressure threshold as opposed to your pain threshold, if you're for whatever reason on a spot you're not supposed to be on, too much of a bony prominence, or there's maybe a nerve that's a little bit more superficial there, or the area is just not ready for that particular type of therapy, what that will give you is that feedback of hey, this site is just a bit too sensitive, so get off of it. You're not going to just necessarily move on at that point, but you're going to restart because you may have just gone too deep, especially when you're doing this stuff in the beginning. So start again, go to that 5 again. It starts to increase again, stop again, restart a third time, gets to that threshold, it starts to increase again, stop, and now we're moving. We're just going to leave that one spot alone. Maybe it's just that day, maybe it needs a couple of days, maybe you need a professional to take a look at that, maybe you need more diagnostics on that area, but move it a fraction of an inch and repeat that. And if it continues to give you that same type of response where you think you're stopping at threshold and continues to increase, the next thing we're going to do is we're going to stop at a notch lower than that 5 out of 10. So whatever you thought was a 5, we're going to go to a 4. And then we're going to try the same thing 3 times. If it increases, we're going to stop again and go to a 3. out of 10. So very easy. And we're going to hold that and see if that goes to a 2. I've seen this over and over again. I think it's people's response to, especially in the beginning when they're doing this therapy and they don't really have a grasp on it. They're having a hard time gauging exactly where their pressure threshold is. And they have a difficult time achieving that. They overshoot it. So we're going to step it down. Now, if you're at a 3, and that spot is still doing that, and it does that 3 consecutive times, we're leaving that spot alone until you can get it evaluated because something else may be going on in there. Another rule, I know I've said in this video that I've held spots for 2 minutes. I've been doing this for 25 years. I know what I'm doing. I know what to expect. You are only going to hold a spot for 30 seconds. If you hold a spot for 30 seconds and that spot does not fade, you're going to do the restart again. I'm not saying leave it alone necessarily, but you're going to do a restart. You're going to go back to that pressure threshold and you're going to hold it. As long as it doesn't get worse, hold it another 30 seconds. If it doesn't fade, do it a third time. And at that point, 30 seconds, it doesn't fade for 3 times at that pressure threshold, you're going to move on to the next spot. And again, incrementally, we're moving quarter to a half inch at a time. Um, so that's kind of the compression to distension technique in a nutshell. It's a form of common compression techniques, except we're just simply camping out on one spot at a time and we are holding that spot until it does what we want it to do. And that is the objective. That's when you walk away successful. So often we just do these things and we're just pushing as hard as we possibly can. And we hold that for some just some arbitrary moment in time and expect that to sort of achieve a result. And it's not necessarily terrible, but it's not as clean, it's not as pure objectively as you're going to get with this technique. So please practice it. I'm open to feedback. Like I said, I've been doing this for 25 years. That's how I explain it here in the office when we do it. I've seen it successfully achieve that desired result so many times. That's why I'm so adamant about teaching it this way. Follow the now understanding that everything that we go into with the cane RX and treating all these various types, other areas of your body are going to be principled on that compression to distension technique or C2D. Okay. So please comment, leave questions down below. I read them and I want to know how I can better maybe explain this or perform this, or I'd love to hear your feedback on whether or not it's working, how it's working, and what it's worked for, and what you may want to see videos geared towards as far as like what particular ailments that you might be struggling with that I could possibly do a video, and help you out that way. I hope this helps.